Hello and Assalamu alaikum. Welcome to my tutorial about behavioral modification. Behavioral modification is a process that is used to permanently change negative behaviors in favor of positive, desirable behaviors that may lead to adjustment, changes in maladaptive behaviors, health, and well being. Changing a behavior is a tough task, as it calls for stopping an undesirable or negative behavior, preventing relapse of that behaviors, developing positive behaviors, strengthening a positive replaced behavior, maintaining the positive or the desirable behavior. Not every can just stop their behavior. There's a process or there are techniques that can be followed. Some professional help may also be sorted or needed. And in this particular video, we shall be discussing that behavior can be modified by applying the approach of operant conditioning, which may help in replacing the undesirable behavior with the desirable behavior. We may like to bring a change in behavior of our client in clinical practice, or an employee in the organizational setup, or a pupil in some educational institute, or some kind of health related behaviors of people, or simply our own self. However, the change is a difficult task to manage, but can be possible if we exert the correct approaches to reform the behavior. Whenever we have to reform a behavior or modify a behavior of another person, specifically when we are doing it for health related behaviors or when we are doing it in clinical practice or educational counseling, we involve the client, and the client has to exert some kind of self monitoring and self change as well. So the effective self change depends on doing the right things at the appropriate time to promote establishment of a desired behavior. Self change generally follow a certain path or process. These processes have characteristic qualities exemplified by behaviors, actions, and attitudes of the individual. We need to progress through the stages of self-change, which can be enhanced by specific actions or processes. Self-change is a process that is not linear, rather it is circular and cyclical in nature. The process of self-change can be recognized in any effort towards a change, be it change of addictive behaviors, be it change of or establishing of the healthier self-discipline, or some kind of modification of um, maladaptive behavior or some kind of habit disorder. Let's take a look at that. What are the stages or what is the process of change in order to understand that what an individual goes through while modifying his or her behavior. Here we have this model that explains the stages of change. And here we will be starting from the pre-contemplation stage where the individual enters first. But this particular stage that is known as pre-contemplation, it almost takes around 6 months that the person stays in the pre-contemplation stage because the individual does not recognize the need for the change for the particular problem behavior. The individual is unaware about the problems, does not know about the pros and cons of the change behavior. Actually, the person wants to change the people around them or him, and the person doesn't want to change himself or herself. And what can be done or what is required at this stage is that is consciousness raising, that is learning about the problem behavior. Similarly, there can be some kind of social liberation, that is the alternative offered by the external environment towards supporting a behavior of the individual to change or the efforts to change. For example, no smoking area availability or alcohol-free drinks. So these may help an individual in order to get rid of the addictive behavior. And as I said, that the individual usually takes around 6 months and stays in pre-contemplation stage. in order to move to the next stage that is known as contemplation. At the stage of contemplation, the individual is able to recognize the problem and consider that there is the change that is actually needed. The individual starts thinking about the healthy behaviors, which almost takes around 6 months again. The individual tries to become thoughtful, but here again, the individual is ambivalent. Whatever the individual tries to attempt, he or she does it forcefully, tries to make some kind of considerations for solution of the problem, struggles towards the understanding of the problem, and the however the individual is, as I said, is still ambivalent. The individual is not ready to actually commit that. So it is a transitional phase to the next stage of the change, and the focus shifts to finding the solution and looking at the future. And what is needed is the emotional arousing. Along with the consciousness and social liberation, the need is for emotional arousing. That is motivation to change, which depends upon the deeper emotional experiences and awareness made by the individual. And another very important aspect which is needed is the self re evaluation. That is appraisal of self problems, what are the challenges, then what is the desired behavioral change, what behaviors will be actually used or required for the change. And after staying in around 6 months in contemplation stage, the individual moves or transits to the preparation stage. Preparation stage is also known as determinism. Here, the individual is ready to take the action within the next months, which means that here again the individual takes around 30 days or a month in order to take action. Here again, the ambivalence still exists. A number of small behavioral changes may be initiated by the individual, which means that small and peppy steps are taken to change the behavior. They may believe that healthy life is important. So we find a change in the thought pattern of the individual. A careful plan at this stage with a detailed scheme for action promotes success. And what is needed at this stage is commitment, that is taking on a firm decision, and there's the personal responsibility to change a behavior. And that is what we make our clients do. We prepare them and we ask them to get committed for the change. And also countering, that is substituting the healthy behaviors for the unhealthy ones, like for example replacing the sedentary lifestyle with active and physical lifestyle that may be involving exercising and so on. For the preparation in this cycle, you would see that there is a slash and action initiated for change is also mentioned over here. However, we can consider that after the preparation comes the next stage, that is action, where the individual actually act upon whatever has been decided, or we can say that whatever steps or whatever new behaviors have been selected by the individual while thinking about or making the countering attempts. So the individual, what he or she does is that overt modification of behavior is actually exerted, that is actually acts out on the recently or newly changed behavior. And what is needed here is environmental control, that is restructuring the environment, removing those substances or those triggers in the environment that may make individual to start the previous behaviors. which means that from this stage there is a possibility that an individual, if is not committed, or if it is he or she is not able to stay right on the track, there are chances that the individual may go into the relapse and may revert back to the previous behaviors. When the individual successfully takes the actions and is committed, the next stage is the maintenance stage. Regarding the maintenance stage, here the individual sustains the behavioral change, that is, the new behaviors are at practice as well as they are sustained. There are consolidations of the gains attained during the action stage. There is commitment, there is reward, there is encountering, there is environmental control. But with all these things, there is one more thing, that is helping relationships is needed. That is emotional and behavior change needs to be supported by the others in the surrounding of the individual, that is significant others, or the individual, or at a group level by the peers or the family members. When it is maintained or it is not maintained, it has an influence onto, again, relapse. If the individual is unable to maintain, the individual moves to relapse, and relapse is basically that the individual tends to leave the treatment or the individual reverts back to the previous behavior. Obviously, when the individual would leave the treatment or the new behaviors, there will be relapse of the previous behavior. And if there is not relapse, the individual does not go into the relapse. So there is the next stage, that is the different stage. We consider that stage to be the termination. That is, the former problem behavior no longer presents any kind of temptation or the threat. Well, there is some kind of dispute to this particular stage of termination. That is why it is not mentioned in the stage of change, because there are consideration that whether this stage of termination is realistically possible, or there are difficulties because of the reason there are always chances to relapse. However, when we make utilization of reinforcement and punishments, then there are more possibilities that we would be able to understand and apply the specific kind of model, and we can be able to sustain the change of the individual, as well as the self change made by the individual would be more maintained and sustained. Here is an example of healthy behavior of exercising, and sometimes people are able to carry it out, and sometimes people drop out of it. The research has documented that there are benefits of physical activity and healthy lifestyles, and now more and more people are accepting that exercise is beneficial to health. And we do see that there are different kind of boot camps and different kind of fitness clubs that are opening up in the town. So here we have an example of healthy behavior of exercising that is based on this model of change. That is, initially the individual contemplates regarding the exercise, that it is needed or not needed. There is realization made by the individual for the need for exercise. The individual then considers about the fitness course. And when the individual actually thinks that there is a need, then the individual enrolls in the fitness course, participates, actually action is taken, and exercising is carried out by the individual. And then when it is completed, that is, the course ends, that is, we can say that the whole program has terminated, and we do see that there is new change behavior of the individual. However, when the individual goes back to the situation where the course is no more, at times maintenance is not made by the individual. The individual leaves the new healthy and active habit of the individual, that is the healthy behavior of exercising. And we find that there is stopping of the exercise, and we find there is a relapse to the sedentary lifestyle because of the reason that the individual find excuses for not exercising. So this actually shows that how the individual who had actually acquired a new behavior that was healthy but it was not sustained by the individual, and then the individual reverted back to his or her own previous behavior. Operant conditioning, which is also known as instrumental conditioning or sometimes referred to as reinforcement theory, it proposes that you can change someone's behavior by using different kind of rewards or reinforcers, and sometimes you can also modify the behaviors by the usage of the punishments. The proponent of operant conditioning was B.F. Skinner, and he was of the opinion that through operant conditioning an association is made between a behavior and a consequence, whether negative or a positive, for that particular kind of behavior. Open conditioning is a type of associative learning process through which the strength of a behavior is modified by the consequences, which may include addition or removal of a particular stimulus that may be desirable or undesirable by the individual. Right here, in order to understand operant conditioning and the mechanisms of reinforcement and punishment, we have a quadrant over here that can help in order to understand that what is reinforcement and what is punishment. Generally, reinforcement is used always to increase the behavior, and punishment is used in order to decrease the behavior. That further has types positive and negative. Positive reinforcement and negative reinforcement. When we say that it is positive reinforcement, we add a stimulus, and that stimulus is a pleasant stimulus in order to increase the behavior. And when we say that there is negative reinforcement, we remove a stimulus, and that stimulus is unpleasant stimulus for the individual. And that is again carried out with an attempt to increase the behavior of the individual, that is a desirable behavior. So whether it is positive reinforcement or negative reinforcement, we actually use it to increase a behavior. We'll be discussing some examples in a while. However, when we talk about punishment, punishment is always used to decrease the behavior. We usually add unpleasant stimulus in order to decrease a behavior in the positive punishment. However, in negative punishment, we remove a pleasant stimulus that is desirable by the individual, but we remove it in order to increase the behavior that is desirable by us. So there are two symbols that have been made with positive and negative, which means whenever there is positive reinforcement or punishment, there will be addition of a stimulus. However, for the reinforcement, there will be addition of a pleasant stimulus, and for punishment, there will be addition of an unpleasant stimulus. Similarly, when it is negative, we remove a stimulus. For reinforcement, we will be subtracting or removing a stimulus that is unpleasant. Sometimes we provide escape to an individual. That is, if there is an undesirable task for the individual, we ask the individual not to do that in order to increase another behavior that we are interested in increasing. Or sometimes there are avoidance behaviors or avoidance that is provided in order to decrease the behavior. Similarly, when it is negative punishment, we remove a pleasant stimulus. In negative reinforcement, we remove an unpleasant stimulus. However, in negative punishment, we remove a pleasant stimulus in order to decrease the behavior. For instance, if you talk about that how operant conditioning follows a specific process, we may say that, for instance, there is an athlete who performs a behavior. And that particular behavior is selected by the coach to be increased or decreased. The coach chooses how to respond to that behavior. If the goal of the coach is to increase the frequency of that behavior, the coach should provide the reinforcement in form of appraisal, in form of some kind of encouragement, and the reinforcement can be positive or negative. If the goal is to decrease that behavior, the response should be punished. For example, the individual is coming late for the practice or the sports activity, then that behavior can be punished. However, the extensive research has shown that there are limitations and problems utilizing the punishment. It creates a short-term fix but creates long-term distress for the individual. So the goal of the coach should be to use reinforcement in order to increase the desirable behavior. But however, punishment is used in order to lessen the non-compliant behaviors, merely to suppress or inhibit the behavior, or you can say development of negative feelings towards the individual or the environment. So we may make utilization of some kind of threat of harm to follow adherence with the medical advice that is often used by the doctors in order to increase in order to decrease the behavior of the individual that is of non-compliance. Alright, in order to better understand the concept of reinforcement and its types, here we have a few examples. For example, um, the desirable behavior, whenever it is followed by the positive consequences, there are chances that the behavior will get strengthened. So, whenever a teacher praises the student for the effort have been made by the student and the teacher is praising, what happens is that that particular behavior also gets strengthened and the student becomes more active in the class. Similarly, at workplace, the manager rewards the employee for the productivity, which is a reward, which is a consequence, which is a positive consequence. And as a result of that, what happens is that employee increases his productivity. So this behavior of productivity increases and enhances. Instructor compliments for losing the weight to the participant. And by taking this compliment, the behavior enhances and the participant increases the efforts to shed weights. On contrary, we have some examples related to negative reinforcement, which indicates that when desirable behavior is followed by removal or negative consequences, again the behavior is strengthened. For example, a mother removes the responsibilities of household chores, which is not actually liked by the daughter. So what happens is that mother is doing that so that the daughter would put in more efforts for getting the grades and for studious behavior. So as a result, that behavior is increased and the daughter puts in more efforts in the studies. Similarly, the manager is criticizing, and due to that critical remarks, sometimes the employee do not like that. So when a manager stops nagging the employees start being more productive. So the manager basically takes away this negative consequence uh, that is not liked by the employees in order to increase the other behavior that is productivity, and as a result employee starts being more productive. Similarly, for the health setup, we say that the instructor removes some of the disliked vegetables from the diet chart of the participants enrolled in a weight loss program. And what happens is that the participant, as the diet chart has been transformed and it has been added with the things that the individual likes, and those things which are not like are have been removed, so the participant increases the efforts to eat more healthy or follow that particular diet chart more strictly. Okay, so next we have examples for punishment in order to understand the concepts of negative punishment as well as positive punishment. When we talk about negative punishment, the desirable behavior is followed by the removal of the positive consequence. That is something that is desirable by the individual or liked by the individual. It is taken away to punish the individual so that his behavior that is undesirable may get decreased. For instance, there is a student who is continuously using the cell phone in the class. So, as a punishment, the teacher takes away the cell phone, and what happens is that the student reduces the usage of cell phone in the class. Similarly, the traffic constable confiscate the driving lessons, that is the driving license has been taken away from the individual, and as a matter of fact what happens, there is a change in the behavior that the driver tries to stop violating the traffic rules. So again there is a reduction in violating traffic rules. Similarly, in a clinical setup, there is a client who has deposited some amount of money as a contract with the therapist, and the client is enrolled in a smoke cessation program, and the client, whenever is not adhering to the abstinence of smoking, what happens is that the therapists rip up the money deposited by the individual. And as a result, what happens is that the client stops the non-compliance of uh, the regime and continues to follow the regime. Positive punishment examples: here the desirable behavior is followed by the negative consequences. So what happens here is that the punishment is provided in order to decrease a particular behavior. That is, the manager reprimands or criticizes or provides a show cause notice to the employee for the negligence. And what happens is the employee cuts down the negligent behavior on the job. Similarly, the husband keeps nagging about taking the medicines for the wife so that she can follow the health regime and can have the adherence to the treatment. So, this nagging is undesirable by the wife. So, what happens is that wife stops the non compliant behaviors. Similarly, the electric shock is given, and for whenever the individual has an urge to smoke, and as a result the behavior of the client is to refrain from smoking. So due to that punishment that is received by the client refrains from smoking. I hope that by now you would be clear regarding that what are the types of reinforcement and punishment, what is the conceptions regarding these, and there would not be any kind of overlap. However, there is a specific thing to remember, which usually the students are unable to comprehend, or they find an overlap or get confused. That is, negative reinforcement is not the same as punishment. So we can say that negative reinforcement and punishment are not interchangeable terms, because it is negative reinforcement, but negative reinforcement is used to increase a behavior. However, whether it is negative punishment or it is positive punishment, whatever form of punishment it is always used to decrease a behavior. So when Ever you are finding that these are not appropriately applied. So when you would not plan it accordingly or rightly, what would happen is that the behavior would not get replaced or modified. There is possibility that you consider that it is a punishment, however that is actually in fact negative reinforcement. So what happens is that rather than the behavior that is desirable behavior that gets reduced, rather what happens is that it gets increased because maybe you're using the negative reinforcement. So always remember that negative reinforcement is not the same as punishment. We can get to know about it if it is actually working the way we want it to work, that is, the desirable behavior is increasing or it is decreasing. The next step for application of these reinforcement or punishment phenomena is to understand that when and where or how we are required to provide these reinforcements or punishments. So for the reinforcement, because it is generally said that it is more suitable to use reinforcement and generally avoid punishment. So we will be discussing regarding the schedules of reinforcement. These schedules of reinforcement are actually, we can say that these are the precise rules that are actually used to present or to remove the reinforcers or at times the punishers following a specific operant behavior exerted by the individual. These rules are defined in terms of time or sometimes number of responses. We'll be discussing that in a while. So generally, we classify the schedules of reinforcement into two types. The first one is continuous. Continuous reinforcement means that every instance of behavior is reinforced. That is, each and every response made by the individual will be reinforced. That is, appreciation will be given, for instance, or any kind of reward will be given for each and every response. However, it is not that much suitable because of the reason that the behaviors that are reinforced through continuous reinforcement tend to extend more quickly and easily. However, these behaviors, when the individual is actually learning a particular behavior, these may be used for the initial planning or change in the behavior. For example, there is a child who is autistic in nature or is learning a particular behavior, or you ask a question to a child and responds correctly. So on every correct response, the reward is given so that the individual can be brought to a specific stage, or you can say a specific line of change. Similarly, because we are saying that continuous reinforcement does not stay that longer and generally tend to extend more easily. So what can be done is that we may utilize the other form of reinforcement schedule that is known as partial reinforcement. The learned behaviors that are required by the partial reinforcement are more slowly acquired in comparison to continuous one. That helps in a quicker learning of a behavior or change in the behavior. But in the partial reinforcement, though the behaviors are acquired more slowly, but the response is more resistant to extinction. We will be discussing why it is more resistant to extinction uh, when you will be having the discussion regarding different types of partial reinforcement schedules. Before we start discussing regarding its types, there are some terminologies to be understood. For example, fixed and variable. When you talk about fixed, it refers to number of responses between the reinforcements. or the amount of time between the reinforcement, which is actually set and unchangeable. When we talk about variable, the term of variable refers to the number of responses or amount of time between the reinforcement, which varies or which is able to change. Similarly, we have two other terminologies which are interval and ratio. Interval means the schedule is based on time between the reinforcement, and ratio means that the schedule is based on the number of responses made by the individual between the reinforcements. That will further get clarified when we will be focusing on the types. So partial reinforcement is generally classified in two further categories, which are interval schedule and ratio schedule. So this is the interval which I was referring to, that it is based on time. So it depends that we decide about the times that when the reinforcement will be provided to the individual. And this ratio schedule, which basically focuses on the number of responses. Both these types, interval schedule and ratio schedule, are further having two different types which are classified as fixed and variable. And all these types, we can combine them to create four different types of reinforcement schedule. That is interval, fixed interval schedule, variable interval schedule, fixed ratio schedule, and variable ratio schedule. So firstly, we will be discussing regarding the fixed interval reinforcement schedule. It is used when the behavior is rewarded after a specific set of amount of time. For example, we say that Miss J undergoes a major surgery in a hospital. And during the recovery, she is expected to experience pain and will require prescription medications for pain relief. She is generally given an IV drip, that is intravenous drip, with a patient controlled painkiller. That is, it is up to her that she can use a painkiller if the pain goes out of her hands, or you can say it becomes unbearable for the individual. Her doctor sets a limit, one dose per hour. So Miss J pushes a button when the pain becomes difficult, and she receives a dose of medication. But it is fixed interval ratio, fixed interval reinforcement schedule. So what happens is that the reward, that is the painkiller or the pain relief, only occurs on the fixed intervals, that is after 1 hour. There is no point in exhibiting the behavior when it will not be rewarded. That is, if she will be exhibiting the same behavior before 1 hour, it will not be rewarded. Similarly, we have a variable interval schedule when a person gets the reinforcement based on varying amounts of time, which are unpredictable. Let's say that Mr. M is the manager at a fitness club. Every once in a while, someone from the quality control division comes to his club in order to monitor its activities and in order to see that what is the hygiene level, as well as how well the participants are doing, if it is clean and it maintains good services for the participants enrolled in his class. And if the things are right in place, he earns a level up in the ranking. However, he never knows that when the quality control person will actually show up. So, because he doesn't know about it, that when he will be rewarded, He doesn't know that when the quality control person will actually show up, so he always tries to keep the services. And his productivity regarding his fitness services are steady because he wants his fitness club to earn the higher ranking. So we see that there is consistency of a behavior of the individual that is desirable by the monitoring team. The next we have fixed ratio intervals, fixed ratio schedules, and here we have fixed ratio reinforcement schedule, in which there are set number of responses that must occur before the behavior is rewarded. For instance, Miss C is a cancer patient, and she earns a meal every time she takes her medication without any non-adherence to her treatment regime. This makes her strictly adhere to her regime and maintains her health conditions. Similarly, in variable ratio reinforcement schedule, the number of responses needed for a reward varies. However, it is said to be the most powerful partial reinforcement schedule. We can have an example of variable ratio reinforcement schedule that is of gambling. Let's imagine that there is a person who visits a casino for the first time. He or she is not actually a gambler, but out of curiosity, the person puts a coin in the machine, and then another, and then another, and then another. Nothing happens, but a few bucks are actually lost. And due to that, he or she starts losing the curiosity. But when he or she is just about to quit and leave, the machine lights up, bells goes off, and the person wins and gets some money back. How does this sound? That's more like it. And she is or he is being rewarded. So what happens next? Yes, you all are thinking right. The person gets back to inserting the coins with a renewed interest. And a few minutes later, he or she has used up all money um, as he or she does not know that when the next reinforcement is coming. This means that the behavior has been reinforced and strengthened, and here that is based on the variable ratio reinforcement. The reinforcement schedule in most type of gamblings has a variable ratio schedule, and people keep trying and hoping that the next time they will win, the next time they will win, or next time they will win bigger. This is one of the reasons that the gambling is so much addictive and so much resistant to extinction. And that's how we just learned that a maladaptive behavior or an unhealthy behavior or a behavior that is addictive is learned by the individual, though the individual was not actually the gambler. So, in the similar ways, the unhealthy or maladaptive behaviors are learned and can be modified as well by applying the correct reinforcement schedule to a desirable behavior that we intend to increase or we intend to decrease. I hope that these things will be clear to you. And I hope that the tutorial was simple and clear to your understanding. For learning the next techniques to modify the behaviors, please keep watching our other tutorials. Thank you folks for watching. If you like this video, make sure to subscribe for more and like and share the video. Click the small bell icon that appears beside the subscription button to receive the notification the minute our video is uploaded. Thank you for watching. Allah Hafiz.